Hey everyone, this is Ben, and we're here for the Tinnitus Virtual Summit. We're here today with a special guest. This is Dr. Jay Hobbs, who is a chiropractic neurologist in the Central Valley of California. How are you doing, Jay?
I'm great. Thanks for having me.
Amazing. We love your classroom setup. Thanks for bringing us into your YouTube studio because I first found you by looking up tinnitus educators on YouTube, and I stumbled across your work with chiropractor, with chiropractic neurology, and with tinnitus patients. So what led you into your field, Jay?
Yeah, it was a bit of a roundabout, a circuitous route. So I was, as a chiropractic neurologist, I have, we have to read a certain number of peer reference articles every year, so 30 articles. And so I was reading through and, you have some stuff that interests you and sometimes you get some stuff that doesn't. So I was really focused on pain for a while. So that would be typical for a chiropractor, right? So how can I resolve pain? But as a chiropractic neurologist, I wanted to go deeper. People who had phantom limb pain, or what's called CRIPS, or chronic regional pain syndrome. These are people that can't even do physical therapy because their pain is so much, just movement hurts. Sometimes even to think about movement hurts. And so I started looking more into that and found some great researchers out of physical therapists out of Australia that were working with that, and delved into that and came up with some of my own protocols and treatments. And then, and really exhausted most of the info that was relevant there. So then I moved on. But as I was going through that, every once in a while I would find this reference to tinnitus. And I often say tinnitus, maybe it's because I'm from the South. So forgive me if that's not the way you say it, but so I would go and I'd see it. They say, oh yeah, this brain mechanism associated with this chronic pain syndrome is similar to that with tinnitus. It'd just be a little blurb. And I go, well, I'm a chiropractor. What do I want to do with the ears? All right, so that's cool, but okay, no. So, but I remembered that. And so I came back to it later. There was actually one thing in between, and I focused on Alzheimer's and dementia. And there was some really good research that came out of that. At the time that I was starting to look into it, some really effective things that were done with people even in assisted living facilities, which we're hearing a lot about that these days. But with exercise and nutrition, they were able to see even some people who had Alzheimer's or progressed dementia turn around. So that was really exciting. It took a lot of work, and I started to work with an assisted living facility, and they found out that it was really hard. It's harder than being a teacher in an elementary school, because you've got not only to convince the patient, but these patients have caregivers. And so you have to convince the caregiver, and then you have to train the facility. So I learned a lot, but I found one thing I learned, it was really difficult to work with that population in that situation. Then I said, okay, so what next? And then I remembered all that research on tinnitus. And so I looked back into that, and I was really fascinated with the work that was being done, and found that some researchers would go into it, they would do great research, and then they would just disappear. And I'm like, what's happening? And I never did find out for sure, but I suspect that, as a researcher, you have to go where the funding is, and there just wasn't much funding that followed that, it seemed. So I thought, well, I can do this on my free time because I'm just passionate about it. And as a functional neurologist, a rehabilitated neurologist, then maybe I have some unique perspective to offer. So that's really what got me into it.
Amazing. Thank you. We're really happy to have you here for the Tinnitus Virtual Summit. One of the main goals for this summit is to bring diverse perspectives and professionals and researchers in to educate the individual who has tinnitus, who may be looking for some direction. We know that when they go on the internet, there's so many different types of recommendations from different people, because there's many different ways to have a positive impact on tinnitus. So how does your role as a chiropractor bring a unique perspective or therapy to the tinnitus patient?
Right. So I started out the way, I think it's probably still the predominant perspective, and that's that hearing loss is the cause of tinnitus. And so my first video that I ever put on YouTube, that I recall anyway, was called The Most Common Cause of Tinnitus. And so I went into the probable neurological mechanism where we have hearing loss and then adaptation to the brain. The same thing I'd seen in those original articles on chronic pain. And the way we'd resolve that with chronic pain syndrome was You may have heard of mirror box therapy. Sorry if there's a little background noise. We've got some things going on here. So we would have this chronic pain syndrome where there was adaptation in the brain, and our brain's always adapting, and sometimes it adapts in a way that's favorable, and sometimes in a way that's unfavorable. And so, so that's the way I focused on this, and spent my time doing auditory therapies, looking into that. But then I realized and started seeing some patients in my office because I was working mostly online. I was like, well, I found a Dr. Tichy, and he had done muscle work and found some really great results with that. And it's kind of weird, but I had never thought of that as a chiropractor and doing a lot of musculoskeletal work. But I started delving into that, applying his protocols and developing new ones, and found that this is really common and people get some really good results with this.
Great. And when you say getting good results with tinnitus related to muscular work, as an audiologist, a doctor of audiology, when I do my case history, I know all the answers for anything related to the auditory system, but when someone says that they move their jaw or they move their neck and their tinnitus changes loudness or pitch, for a lot of audiologists, we say, well, that's not our specialty, so we don't exactly have an answer. What would you say, or how would you evaluate that kind of patient who comes into your clinic?
Yeah, so so first thing to recognize is, we call that somatic tinnitus, right? And that is, some research has shown that that's as prominent as 80%, meaning that someone, if you really work at it, someone can modulate or change the pitch or number of frequencies or loudness in their tinnitus. They can, 80% of people can change that. And some people who don't even have it normally can create it. So, and if you look at it that way, it's like, well, it pretty much means nothing then. And so, and alone, that's true. It just means they have somatic tinnitus. It means that there's a connection between their somatic nervous system, the muscles and joints, and their auditory system. And they're able to play music with their body. So, so that's really all it means. But then I did some further research, and so that was a little depressing when I found that out with some research. I'm like, well, gosh, I guess it's worthless then. And unless you dial it in a little more, it is worthless. But then the key, here's the secret. Here's the secret sauce. So if there is covariance between the symptom of neck pain or TMJ or headaches and the tinnitus, then that dramatically increases the probability that is a cause. So not just that they're related, but this is a cause. And then if you even further, if you correct the cause of their headache or jaw or neck problem, then you'll dramatically reduce their tinnitus. So that was really exciting.
That makes total sense. That definitely makes total sense. And how does someone in your position, neurologist, chiropractic neurologist, or even other doctors, how does someone treat neck pain or neck strain that leads to tinnitus? And then separately, how is TMJ, temporomandibular joint dysfunction, how is that treated that could have a positive effect on tinnitus?
Right. So with the neck, that's well in the scope of most chiropractors and a lot of physical therapists. And I would say, a good massage therapist can do a lot of good as well, can resolve this in many cases. So, so how does a chiropractor treat neck pain would be one of the questions?
Yeah, let's tackle that first.
All right. So, most chiropractors do adjustments, right? So we use our hands to move the joints, and typically it's a rapid movement, and it's well within the normal range of motion, which makes it really safe. So if you restore that motion, that does several things. So one, there's an immediate barrage of neurological input. So what that means is it's like nerves are like little doorbells, and the ends of them are doorbells. And so it's like sending a lot of doorbell signals up into the brain. And if you send those to the correct place, to an area that's deactivated, then it can help to reactivate. It's almost like putting those little pads on your heart when somebody has a problem with their heart rhythm. So it can be restarting. And most chiropractors don't look at it that way. Mostly chiropractic neurologists think about that. But so a lot of chiropractors, they'll adjust one side, they'll adjust the other side of the neck. And of course, now you've stimulated both. And that doesn't really restore any balance to anything, but it does provide some input. But further, what it does, you've restored motion to a joint that didn't have proper motion. And this goes back, well, I'll give you the end of that, and then I'll tell you how that ties in neurologically. So, so that then provides the long-term restored motion, long-term restored neurological activation to that area of the brain. So it all goes back to the nervous system. But if we go back to the chronic regional pain syndrome, what we found with those people who couldn't even move because of their pain, we had what's called deafferentation. It's like a disconnection of nerve input. So if someone doesn't move, and like if they're in a cast for a long time, most of us can get out of that cast and then go back to normal activity and they're all good. Some people, they go back to, everything seems to be healed, but the brain doesn't restore. So that's an extreme example of this severe lack of movement. But with any fixation or restricted motion in the joints, especially the spine, you have that deafferentation, that disconnection of nerve activity to the brain. And so an adjustment restores that. And then they go do their exercise, regular activities, and now you have that continued ongoing activation of the brain, which then promotes healing of those tissues.
Okay, great. And how about temporomandibular joint dysfunction, or TMJ?
Okay, and so there's more to the adjustment, but that would be like your typical chiropractic. And I'll because the TMJ is going to be a little shorter, because that will fall primarily into the realm of the TMJ dentist, although physical therapists and chiropractors do some work on that as well. So your typical chiropractor will do the adjustment. The chiropractic neurologist will do the adjustment with an eye on its impact on the brain and that restored activity, but also muscle work. So I do a lot of muscle work, obviously, in my office. And so if there's tension in muscles, so muscles always produce waste products. And and that's good, but it should get rid of those waste products through blood flow. Now, if the muscle is too tight, and it can be too tight because of an irritated joint that is trying to protect nearby, it can be because of an irritated mind. This tension, this is the shoulders and neck and jaw is a lot of, it's the way we communicate. It's the way we emote, express our emotions. And so that's how that connects to this tension. And so not dealing with the brain and not dealing with the mind and I know you're going to talk a lot about that with yourself and others. So that's how that ties in. And so if the mind is primary, you can work the muscles all day long and you're not going to correct the problem because it's going to come right back. So we'll do muscle work, clean out those toxins, teach them how to do it. I give them a couple tools that I think are really helpful for doing self-trigger point therapy, and give them techniques. And then habits. So habits are really key. And so I consider it my responsibility as a doctor to help prevent the problems that I treat. And so if I just say, oh, well, your solution is to come see me more often if you're having a problem. So I don't think that's a service. So I do see people often at times, and I teach them, so that eventually they can help themselves. I'm sure I'm helpful ongoing, but they shouldn't need to come to me all the time. So I put the responsibility back on them. And a lot of patients really like that, and some don't. And those are the ones that want medications and surgery.
Mm-hmm. Yeah, that definitely makes sense. Thanks for explaining that. Certainly that relationship between tightness in the shoulders, in the neck, in the jaw, it can keep us in that high alert state, which we know is related to the emotional auditory response of the brain from tinnitus into our body. So it's nice to have these conversations between professionals to share tips and knowledge, ultimately serving our patients the best.
Right. So then with TMJ, the same things will be related. And so as far as habits go, as far as TMJ or neck problems, we're looking at what's contributing. Is it stress? Is it posture? When does it happen? So these are really key part of the history. As doctors, we always learn, history is where you get most of your information, and then your exam is really where you just confirm that presumptive diagnosis you've already made. So is it, do they wake up with it worse? So for example, if they wake up with a headache, or wake up with more, in this case, more tinnitus, it's like, okay, well, it's something that's happening at night. So what's happening? Are you laying on your jaw wrong? Are you laying on your neck wrong? Are you stressing? Did you wake up with your jaw more sore? Like, are you trying to solve the world's problems while you're sleeping? It's not working. but it is causing problems. And so we have to address that then. And so I consider it my responsibility to help them find the cause and address the cause. And that's a lot of work for both of us.
Yeah. Well, that's good. I think that for a lot of people on my side of things, audiologists, even tinnitus specialists, when someone describes it, their jaw is very affected to their tinnitus. We don't know exactly what to do. So if you could give us 1, 2, or 3 steps of what should that individual do who's experiencing a lot of tinnitus and it seems to be related to jaw pain.
Okay. So it used to be that we thought there was 2 causes, and recent research suggests that there's only one. And so the 2 causes were malocclusion, which is where the teeth don't fit together right. And that could be from dental work, a bridge that's too high or something. And that's certainly something that should be considered. And that's obviously in the dentist realm. But recent research has suggested that doesn't cause clenching or grinding, which is called bruxism. Their dentist's fancy word for that. So whenever I see them with TMJ problems, I'm like, all right, we've got to deal with their stress. That's number 1. That's number 2. Number 3. There can be other causes. Obviously, you get hit in the jaw, something like that. There's previous injuries, but those are going to be pretty obvious from the history. So if there's no obvious history that suggests some trauma or new or old, then we got to deal with stress. Even if they say, oh, I don't stress, or I don't clench my teeth, it's like, okay. But just, for the next couple of days, just keep an eye on that. Just see if you're clenching. And most times they'll come back and they go, oh yeah, I totally clenched my teeth. So they're dealing with stress. And so it's about helping them remember. That's the first key. Help them remember that they're to check for it. It's like, oh, I can relax my jaw if I just remember to do it. So we may I have them put, like if they're wearing a watch, I'll say, okay, put your watch on upside down, or put it on the other wrist, or put a ring on you never wear, something to help remember throughout the day. And now with all these apps, you can put timers on your phone, different ways to remember it, just to relax. And so if your teeth are touching throughout the day, you're probably clenching. So the only time they should touch is when you're eating.
That's great practical advice, and that's something that I will share with my communities. And now if someone asks me that question, I'll probably direct them to this recorded video and also be able to explain a bit myself. So thanks for that, Dr. Hobbs.
You're welcome.
All right, so I wanted to ask you more about trigger point therapy and how does that relate to different kinds of tinnitus?
All right. So first we have to determine if the cause, if that's the cause. And if we don't have to determine that, right? If I want to give them a probability of the recovery from this therapy, then I need to determine is it causing it. If they've got trigger points, and if just even tenderness without referral, then it would be helpful for them to resolve that. And so this trigger point therapy, muscle work to clean out the toxins, is going to be good for them. But if I want to give them a probability of their recovery, then I do a good thorough evaluation. This is one of my early videos that I've put on YouTube. It's up to about 400,000 views now. It's not quite as good as a funny cat video, but and it's been really interesting to how a lot of people have resolved their problem just through the evaluation. I'm like, wait, I have a program you're supposed to buy. But that's okay. I'm happy that they got well. And if it was that easy, then they shouldn't have bought my program anyway. But it's pretty amazing. So I forgot your question.
The question was for someone who's never heard of trigger point therapy, what should they know about it?
Okay. So it's been around for a super long time. So a lot of massage therapists are well trained in it. It's related to referred pain. And that's how we came to even try, or Dr. Chichi came to even try the trigger point therapy to resolve tinnitus. So we know if someone has a heart attack, you go, okay, where do you feel the pain? Well, you feel chest pressure. You might feel pain in your left arm, or maybe even for women, it's more common up your neck or face. Is your heart in your left arm? No, I mean, it's closer to your left arm than your right, but it's not your left arm. So why in the world do you feel it in your left arm? Well, all deep tissues, especially muscles, have referral zones. And this relates to the development during embryology, but basically it's shared nerve pathways. And these shared nerve pathways is why trigger point therapy can help tinnitus. So trigger point therapy is massaging the muscles to clean out the toxins. It needs to be done regularly. So what is regularly? So a few times a day is good to do. It doesn't always have to be, but I'll treat people, and I'll treat them depending on how severe it is, up to 3 times a week, usually not more than that, and usually not that much. But I want them to be working on those muscles a few times a day if they can. Just a little bit, not to hurt themselves, just to be cleaning those toxins out often. Because if you're decreasing the toxicity on those muscles, then you're decreasing the irritability of those nerves that are in the muscles that feed back into those common brain pathways.
Okay, that's great. And the trigger point therapy can have applications for many different kinds of conditions. Who would be the right person who's trying to use it to affect their tinnitus?
Yeah, so that goes back to that prognosis. And so I have questions that I ask, and also have an online questionnaire. It's called the Tinnitus Recovery Score. And so there's several different questions, and a little bit of, they can do some self-evaluation, but those 2 questions that I ask, those are the most simple and the most clear. I guess it's really one question, but applies to different areas. So does your symptom co-vary with your tinnitus? So for example, if you have TMJ pain or headache or neck pain, does that get worse at the same time your tinnitus gets worse? And does it get better same time the other gets better? If it does, then that's really where you need to focus, because there's a high probability that's going to help. And so trigger point therapy and habit correction and stress reduction are going to be really key for those people. And habits also, I didn't mention, there's a lot more people working from home these days with lousy workstations, right? Here's the one key: laptops. Laptops are no good, and in their original configuration. So right now I'm using a laptop, but I'm standing up straight. If my laptop were down correct for my arms, then I would be like this, all right? Or if it were up for my head, then I would be up like this. And this creates tension in these muscles. And so habits at home are key to resolving your trigger points long-term.
That's great. That message and what you've shared so far is going to help a lot of people, and already has with the offerings you have online. So again, this is Dr. J. Hobbs, who's a chiropractic neurologist, and you have some online programs. One of them is tinnitussynergy.com, and you're also on YouTube, Dr. J. Hobbs of Synergy. Would you like to share with us any of your programs, as well as other ways that folks who want to contact you can?
So those are good ways to go. And so I always like people to kind of self-qualify themselves, it's before you get too far into it, and certainly before you spend any money. And so that tinnitus recovery score is a great way to go. And so you can go onto my tinnitussynergy.com and take the tinnitus recovery score. And it's 2 parts. I have a brief one that's about 3 minutes long, but it's not as viable. It's not as prognostic. Can't tell you for sure whether it's going to help you. And of course, nothing can tell you for sure. But the longer one takes about 30 minutes. It's a bit of an investment in time. There's 2 parts to it, but you'll get a report back, and it'll let you know what therapies may be helpful. So we go into stress, sleep. There's a lot of questions on eating. So that's where we apply that research I did with the healthy brain. It's called the healthy brain lifestyle. And so it gives you a lot of assessment, and then ask the same questions about your covariance of symptoms. And then it'll give you some probabilities about what might help. And then you can go forward and see if there's something, what would be most helpful for you. And some people use my program on their own, and some people use it in conjunction with a local professional, whether it's an audiologist, physical therapy, chiropractor, etc.
Amazing. Well, there you have it, guys. My name is Dr. Ben Thompson, audiologist and tinnitus specialist in California. And this is the Tinnitus Virtual Summit. We're here with Dr. J. Hobbs. Jay, I'll give you the last few words here, and then we'll sign off.
All right. Well, thanks for the time. And I appreciate the work that you've done, Ben. And this is really valuable for everybody. And I appreciate us connecting together. And I look forward to working with you and others in the future.